Definitely is not a miracle, and but I have seen miraculous things happen, so that's sure for sure. But I don't want to set people up thinking that this is going to be a miracle. Healing does take time, and there are many factors why a person is sick. So stem cells can address multitude of factors, but there may still be other things going on in the body if you don't have the right microbiome, right? If your gut is there's not enough good bacteria to help you process food, to help you to guard your intestines and to produce the right chemicals for your body, that's going to prevent you from healing. If you have toxicity, whether it's organic toxins or heavy metal, these are going to prevent you. If you have hidden infections, that's always going to cause problems. So we have to realize that yes, the cells can have so many benefits, right?
Welcome to Old God Talks to Me, a podcast dedicated to helping guys create kick-ass lives for themselves and those that they love. Ladies, if you want to know what your guy is thinking, this podcast is for women too. Each week, a special guest helps you create that life you've imagined. We talk anti-aging medicine, personal growth, relationships and hot sex. Yeah, you hear me, getting laid more frequently, other guy vices, and topics that many don't want to talk about but need to. Just because you're getting older doesn't mean you have to be old. Don't want to miss anything? Be sure to subscribe, share, rate, and review this podcast. And be sure to go to www.thestandard.academy/magazine and grab a free copy of our new digital magazine, The Standard Academy, where we talk about erogenous zones, growing hair back, and other things that will help you create that kick-ass life. Now get ready to listen up and share with friends.
So what's that's really interesting, because I know a lot of people talk about using their own cells, and I've had this discussion with friends, and they said well, they said it's good till I'm 40, and I'm like, well, I don't really think so. That's not what I've heard.
Yeah, so I'll just give a number. So when we were born, every 1 in 10,000 cells is an MSC, mesenchymal stem cells, the one that wraps around blood vessels. When we reach our teenage years, it becomes 1 in 100,000. When we reach our 40s, your friend, is 1 in 400,000. When we reach our 80s, is 1 in 2 million. So you have 40 times, 1/40th, basically, number of cells as when a new baby is born. And what's interesting is birth tissue, the cells in the birth tissue is actually younger than the stem cells in the baby, because they were trapped early when the embryo was formed. So they carry a lot of the embryonic characteristics, but they don't have the potential to cause teratoma, that uncontrolled tumor growth. Sure. So it's kind of the best of both worlds.
Yeah. So any other myths that you want to share with us?
Yeah. So also some people think more cells is better. And no matter how the cells are obtained, if the cells, let's say we're using birth tissue derived stem cells in my clinic, these are completely unmanipulated, and they're unaltered stem cells. So yes, the more is better up to a certain point. There's a point of no extra return, but it's going to take a lot of cells to reach that point. Yes, the more is better. But if you're going to expand the cells, which is what most clinics do when they give you huge numbers, or especially overseas, in the US, they can't really do that, because once you start to grow the cells, you have to have a clinical study. So they don't want to go through that. So then they set up shop in Panama, in Costa Rica, in Mexico, in Colombia. So all these places, they can grow the cells to a huge number. So imagine if there are 10 million cells, they can grow to 10 billion, right? So all of a sudden, from a cell that they can give to one person, they can, even if they give 10 times to the person, to one person, they can give it to 100 people. So all of a sudden, imagine the profit margin. So I hate to say that, but that's, that's what it comes down to. So when you give people huge number of cells, just because there's more doesn't make it better. So I have a slide that, I was at a conference, somebody actually studied the clinical efficacy, the potency, the activity of the cells. Up to a certain point, a little more is better when it's native cells, which means unmanipulated. So let's say you give 100,000 cells, you reach this level of a benefit. And when you give 1 million, you're much higher, you reach this level. So much higher. Let's just say this is 90%. So when you give, you know, the 100,000, it reaches 20%. And then you give 1 million, it reaches, you know, 90%. But when you give 10 million, guess what? It goes down. It goes down to like 70%. So just because you have 10 times the number, but it's expanded, that you've grown them in a you know, incubator, even though you're giving 10 times as much, the efficacy is dropped. So that's why I think that's a common misconception. Oh, I'm getting 200 million cells. I'm getting 300 million cells. Unfortunately, I've seen people who have done that, and I'm giving about 1/10 the number of cells that these people are getting, you know, maybe 1/10 to 1/5. They're getting better results than these huge numbers that they're getting overseas. So that's another common myth, that they think the more is better, and they're not looking at how these cells are obtained. And then another common misconception is that people think that somehow I guess the word umbilical sounds a little similar to embryonic or something. I hear a lot of people just, you know, kind of mix those up. So umbilical is from the umbilical cord, is when the baby is born, right? It's the cord that's attached to the baby. You cut that cord, usually you toss it, but now we're utilizing it. So that umbilical cord cells has nothing to do with fetus or embryos. You know, we don't use, it's not legal to use fetal cells, period. Not in this country. You know, I don't know, I'd probably go to jail if I use any, you know, I don't know anybody that does that in this country.
Right.
So, and it just boggles my mind. How did that myth, how is that persisting? Why are people still saying, oh, are you using cells from a baby? You know, from a fetus? No, and no one in this country is doing that. You know, if they are, let me know. And, you know, that, you know, it just, it's just strange that this is persisting. And then another misconception I talked about is that people think the cells work by becoming the cells of that tissue, and they forgot how the cells actually work. The cells work by talking to your immune system and coordinating a repair activity between the immune system and your local cells. So they don't rarely go in and form new cells for you. So you have local stem cells in each organ, and they can wake up those cells. So those are the common myths.
Okay, so let's switch gears into the 5 common mistakes that doctors make in terms of stem cell therapy.
Yeah, so one is that doctors, just philosophically, they think all the different types of MSCs would achieve similar results. And you know, because of that, you know, common misconception, that's why I put out that video. It's a 40-minute video, very, you know, kind of sciencey. It talks about why all these different sources of MSCs are not the same, you know, whether or not it's from your own body or even from different compartments of the birth tissue. If it's from the the amniotic membrane, which is the membrane that wraps around, you know, the embryo, and or if it's from the placental tissue itself, or it's from the umbilical cord tissue, or if it's from the umbilical cord blood. All these compartments will contain mesenchymal stem cells, and they're all a little different. So doctors somehow lump everything together. They think, oh, it's a mesenchymal stem cell, so it doesn't matter where I get it, they're going to be the same. No, I went through different studies from around the world comparing these cells directly. So if you actually go through the lecture, you will see they were comparing, you know, all their activities, their ability to you know, to produce clinical benefits are quite different, and their differentiation pathways are different if they do differentiate. So when they have certain potentials, they will secrete different peptides to promote the regeneration of that system. So some are better for nervous system, some are better for immune system. I mean, they have all different directions depending on what compartments you get these cells from. Another philosophical, I think, mistake people make is that they are completely ignoring the systemic impact of these cells, and they only focus on local tissue. They think, oh, okay, so you know, I have, let's just say, you know, a joint problem, you know, I have a knee problem, so let me just treat the knee. So first of all, osteoarthritis is not really a wear and tear disease. It's not just because you're wearing and tearing your knee so much and now you can't take it anymore, your joint just got worn down. If you think about how you wear and tear your body, think about how you were as a 4 or 5 year old and how much you were running around and running into things and jumping up and down. You are producing so much more wear and tear, yet you had no osteoarthritis, right? You're fine. It's because your body has huge regeneration potential, very little inflammation. So the inflammation as we age is preventing our body from regenerating. And the inflammation is a systemic disease. So a knee that we think is worn and torn is really because your body doesn't have the ability to repair it. Because if you put a perfectly good piece of cartilage into the knee, and if it's osteoarthritic knee, it's going to slowly just eat up the cartilage. So it's the environment that's very damaging. So you want to address the body. You want to calm the inflammation of the body. You want to make the body a more reparative kind of environment. So I think, unfortunately, a lot of doctors are not realizing that, invoking the intelligence of your immune system is going to be very helpful. Because what do these cells do? These are cells that are huddling around blood vessels, right? All they do is to sense what's going on in the blood and figure out what's going on in the tissue, in local tissue. And if there's some signals that are in the blood, are telling the cells that, hey, somewhere there's a problem. So the cells will squeeze themselves into the blood vessel and swim upstream to find the location of that signal, and then get out to start to produce certain signals to tell the body to repair. So when we do systemic treatment, we're just putting the cells into the blood vessels, just like how they were going to do before they were transplanted. So put in the blood vessels so they can find where the signals are, and then they can produce their benefits. So that's a powerful thing. I think a lot of doctors are not utilizing, that they're only focused on local tissue. I think that's one reason that I'm having a lot of success, because I'm addressing, how the whole body is functioning. If we want to talk some other common mistakes.
Sure.
There's just very technical stuff. I was, doing this to help doctors understand that, it's not just, you thaw the cells and you put in a syringe, you just shoot it up in the vein, which is what a lot of doctors do. And it's a little scary because, first of all, you need to thaw the cells the right way. You need to thaw the cells in a proper water bath. It's 37 degrees, because a lot of doctors use their hand, and I have done that too, before I upgraded. So it takes a lot longer, probably 30-40% longer time, because your hand temperature is a lot lower than your core temperature. It's not 37 degrees. And also, the conduction, it's, by rolling the vials around, it's just not very efficient. So the water bath is 37 degree, body temperature water bath, and you can thaw the cells a lot more rapidly. The faster you thaw the cells, the less the cells spend time in that particular temperature around minus 59 degrees. That's when crystals can form. While the cells are warming up, the crystals can puncture the cell walls, and all of a sudden you got dead cells. So you want to thaw them out as rapidly as possible. So that's why water bath is important. Another thing is that you need to dilute the cells to a proper ratio. So you don't just put in a 10 cc syringe and shoot into people's veins, because when these cells are very concentrated, they have a tendency to cause hypercoagulability. So that means that it's making your blood, is more, making coagulation more likely. So if you dilute it to a certain ratio, then you don't have that problem. So you need to be, use a proper IV bag and dilute it at the right ratio. And the last thing is that a lot of people are not using IV blood filters, and they were, either using a regular filter, or they were just, shooting up into people's veins. So IV blood filter is really important because it breaks up cell aggregates. So we have to realize that we're using cells. Cells have a tendency to clump together. That's just their natural tendency. They want to buddy up. They all want to, come together. So even the ball of 10 cells, if you don't break them apart, can potentially form an embolus. So that can cause, like pulmonary embolism or other embolisms. And you definitely don't want that to happen to your patients. So these are just, basic safety measures that I see not provided by most doctors. So that's why, I'm setting up the course. I mean, I've been providing this training course for doctors. I want them to be able to provide this in a safe manner. So the training I provide is through American Academy of Integrated Cell Therapy. So that's aaict.org. I think people will be interested to go on the site because there's a lot of research on there, some research excerpts, some case studies. I think, people are going to find it very interesting, and the training course is there.
Yeah, in the show notes, so for everyone listening or watching on YouTube, in the show notes will be all the contact information for everything that we're going to be talking about that we double checked.
Yes.
Make sure it was accurate.
Do you need accountability? Are you looking to change the course of your life but have failed to keep on track? Too often we take in information and fail to act. Do you need an accountability program to stay the course? Then go to www.thestandard.academy and find out about my accountability program that goes with my course that helps you find out what you want, why you want it, and how to get it. The accountability program keeps you on track to get results.
In terms of healing and expectations, what are the stages of stem cell healing, and what kind of expectations, how do you manage your patients' expectations in terms of what the stem cell therapy is going to do for them?
Definitely is not a miracle. And, but I have seen miraculous things happen. So that's for sure. But I don't want to set people up thinking that this is going to be a miracle. Healing does take time, and there are many factors why a person is sick. So stem cells can address, multitude of factors, but there may still be other things going on in the body. If you don't have the right microbiome, right? If your gut is, there's not enough good bacteria to help you process food, to help you, to guard your intestines and to produce the right chemicals for your body, that's going to prevent you from healing. If you have toxicity, whether it's organic, toxins or heavy metal, these are going to prevent you. If you have hidden infections, that's always going to cause problems. So we have to realize that, yes, the cells can have so many benefits, right? Calm your inflammation, shift your immune system to a more anti-inflammatory state, produce more neural protective effects. They're going to help you fight infections, boosting your immune system, and they can directly fight, microbial as well. They help you grow more blood vessels to supply tissue, and they help you to fight cancer cells because they can have direct signals to cause cancer cells to die. And they boost the immune system to kill your cancer cells, but they can also rescue cells that didn't have to die. So there are a multitude of actions that they can promote, but the body is complex. So the way I tell people is that, everyone do respond differently, and there are different stages, like you said. The first stage is the acute anti-inflammatory stage. This is why I've treated patients. For example, this one lady with rheumatoid arthritis, she's a surgical tech, and she had not been able to work because she couldn't make a fist. Her disease is so severe for months. And then when I was giving her stem cell treatment, just halfway through the infusion, and she just did this, and she made a fist, and she started crying. And she said, I haven't been able to make a fist for months. And that is the acute anti-inflammatory effect. I treated a gentleman with liver cirrhosis. He was in hospice. Within hours of the treatment, the swelling in his abdomen, right, the ascites, was going down significantly. That's acute anti-inflammatory effect. I had a lady who had dementia. She hadn't been able to feed herself for months. And the next day after stem cell treatment, she just picked up the knife and fork and fed herself. All of a sudden, it's like the highway in the brain start to right? The traffic is going through. So the signals it's coming across. She can pick it up and feed herself. So all these are acute, rapid anti-inflammatory actions. But that's the first stage. So some people may have it more drastic. Some people, may have it a little bit, not as noticeable. And the second stage is the tissue rebuilding stage. And that's when, let's say I inject into somebody's knee, and here, we're going to have cartilage repair or tissue repair. There'd be slow growth the local stem cells will be activated and they will start to divide. All of a sudden, you're filling up the torn tissue. You start to grow new tissue. Of course, during the growth time, the tissue is more fragile, right? It's like forming a scab. You're trying to build new tissue, and they're not the final structure yet, so they're not secure and strong. So you want to be very careful. You don't suddenly tear them apart. So that's the tissue rebuilding stage, and that's going to take days to weeks time, maybe even longer. So that nervous tissue, that takes much longer, takes months of time. So different tissue grow at different speed. So that's the slow growth and building time, removing bad cells, waste, and then grow good cells, and then build healthy tissue. And then the last stage is the genetic modification stage. Sounds a little scary, but it really means you're rejuvenating your genes, because these stem cells actually were able to secrete what's called exosomes. Within the exosomes, there are microRNAs. So these microRNA are little pieces of RNA that are able to cross the cell nucleus. So when you give the exosomes into the environment, the human body, they can go into a cell, cross the nuclear membrane, and hop onto DNA and start to make repair. So change the methylation patterns. We make methylation changes as we age, and these can help reverse some of the damages, some of the bad changes that's occurring on our DNA, help reverse it. And that's when you see the longer term benefit. Your cells are going to be healthier. So it's going to help you over the long run to do better, no matter what system you're trying to fix. So that would take, months to, the effect can last for years. So these are, the 3 stages. So it's very individualized, but I've definitely seen very rapid response. And a lot of times that's the anti-inflammatory effect. But some, the tissue rebuilding, I call it tissue rebuilding. It's easier to understand when you think about, a joint or muscle, like the repair. But even for other conditions like, autism or neurological diseases or liver cirrhosis, there's still tissue rebuilding in all kinds of tissues that are affected, including the brain. So, the brain definitely takes longer.
So how often do people get stem cell therapy?
If you are coming to a doctor just for a medical condition, right? So then I would say, if you have severe condition, I'm looking at probably 2 to 3 treatments initially. And if you do really well, then great. Maybe you don't need to come back again. I have had people who are doing really well and they haven't come back, and that's great. But if you are somebody that's especially we haven't addressed the underlying causes of your disease, right? Let's say you have rheumatoid arthritis. Why are you getting it? How come other people didn't get it? So what is it about your genetic makeup and your lifestyle and who you are that made you get it? So we need to address all that. We may not be able to change genes at this point, but there's still a lot of things that can be modulated and helped. So if you're not addressing those, then maybe the disease is going to keep pulling you back, right? That's who you are. That's your tendency. So I can repair the damage, but there's going to be new damage that's going to try to come on and bring you back. And then you may need another treatment, in 6 months or in 9 or 12 months. So that could happen. The person could feel, oh, I was doing really well, but, now is, 6 months later, I'm feeling some of the symptoms again. Okay, let's do a booster shot. But it will be nice to address all the underlying causes. That's why I always encourage people to go to a good integrated medicine doctor, a naturopathic doctor, functional medicine doctor, somebody that knows how to address the complex relationships in the body to address root causes. That's going to allow the stem cell treatment benefit to last a lot longer. But if you're doing stem cells for anti-aging purposes, that you just want to enhance your health, there's tremendous anti-aging benefits. I always talk about how I've been doing IV stem cells on myself every 3 months for the last 6 years. So, I did it out of faith, out of reading the science. The science evidence is pretty, unequivocal. Stem cells have these huge benefits for the body. And then, there are other articles showing up about anti-aging benefits. They've studied, animals, rats and mice, and looking at how life could be extended by 30%. And it's not just lifespan, but also health span. These animals look great. Their hair looks shiny, their spine is straight, and they're running around, good locomotion, and they're remembering the maze really well. So everything is preserved. And then when they analyze their muscles and their brain cells, they realize, oh, all these things, that markers showing aging has been reversed back to the younger state. So there's concrete evidence in their neurotransmitter growth factor levels and toxic waste accumulation. Everything was reverted back to the younger state. So if you want to do it for anti-aging purposes, because we are all aging, there's nobody that's not aging. So if you want to do that, then you probably
there's only one cure for aging.
Once and for all.
Yeah.
And so you may want to do it, every 3 to 6 months. I would say I have some patients who are, they want to do it every 2 months and every month. So yeah, you can do that, but it is a costly treatment. But I say every 3 to 6 months is common, and every 6 months, that's the minimum.
Okay, so in this time, everyone has a great website. Everyone has a great website. Everyone has testimonials, whether they're real or not, but they have testimonials on their website.
Mm-hmm.
How does a person out there assess the quality of a stem cell practitioner, and also the quality of the stem cells that practitioner is using? Because I mean, like I said,
it's really tough. Yeah, I just heard from a friend who said this doctor in Beverly Hills, he's charging $30,000 for 1 knee injection, and his cells are not even very good. And it just boggles my mind. I think it's terrible that people are doing it, and they're getting away with it. I just think it's gouging patients. I mean, to me, that's very, very unsavory. But so it is hard. So how did he get patients? How were people willing to pay that kind of money for not very good product? So it is hard. I think that's always a challenge, right? So looking for a good attorney, looking for a good electrician, everything, finding real good people is always a challenge. So I think it's difficult. Maybe find out, where is this person trained? Have they gone through any training? Did they just hang out their shingle saying, hey, I do stem cells too? And then they got some, reps from a stem cell lab telling them, do this, do that. This is how you do it, which is what a lot of doctors do. The reps tell them what to do, what to say, and then they, that's what they're giving to patients, which is not very much value because they themselves don't have the knowledge. Have they taken any training? What have they done to really understand stem cell therapy? So I think that's, one thing. Testimonials, it's funny, I can't even put testimonials on my website because the FDA regard testimonials as making claims. So,
okay.
I would be suspicious of doctors who are doing that. Because I mean, I can't even do that. So it's unfortunate because I want people to know that there's hope, that there are people who have gotten good results. And these are just, things that coming from a person talking about, their own experience, and how that becomes making claim. It's really a little bit mind-boggling because I talked about my story, coming to this country. One reason I came here was because of freedom of speech. I love the concept. I love how people can feel safe expressing who they are, especially if your purpose is to bring good to the world. So how that can become a problem for doctors is it's mind-boggling, and I hope one day that's going to change.
Yeah. So do you offer, now you train a lot of doctors in providing stem cell therapy, and do you have, I assume you have doctors all over the United States that are available for stem cell therapy, and would somebody be able to, would you be able to direct people if they contacted your office to doctors?
Yes. Some states, not every state. So
Right.
yeah. So definitely we do that. We do refer people quite a bit to our doctor network.
Yeah, I think, this is such a novel therapy that sometimes you have to make the trip.
I know. I have a lot of people who make the trip, both, from overseas and all over the US. And, fortunately it's not you don't do it all the time. You do it once, the most, you do it a few times, in a few months span, and then, then it's infrequent. So, yeah, but people do think it's worth it to come to somebody they can trust.
Sure. Absolutely. Absolutely. Well, I want to thank you for coming on the program and talking about the 5 myths and 5 common mistakes that doctors make, and some of the other things regarding stem cells, because there's lots of misinformation out there. So I appreciate you coming back on the program, and it's been great having you, very informative and instructive. And so this is Oris, the official old guy at oldguytalkstome.com, a podcast dedicated to helping older guys create kick-ass lives for themselves and those that they love. And I want you to do several things. I want you to rate, review, share, and basically comment. And if you're going to give me a bad review, that's okay. I love my trolls. Maybe if you really give me a really bad review, I'll send you a nice t-shirt. I love bad reviews. I love bad reviews. How could you think badly of me? I'm not even sure. Until next time, remember, it's all about creating a kick-ass life for yourself and those that you love.
Thank you for joining Dr. Orist and his incredible guest. Like what you heard and learned? Then be sure to do 3 things. 1, subscribe so you don't miss the next episode. 2, share this with someone who may need to hear it. 3, leave a review and rate this podcast. Opt in at www.thestandard.academy/magazine and get our free digital magazine with savings, articles, and deeper dives into cool controversy. Be the guy who takes action. Without action, you're not going to get the results you want. Thank you again, and make it a great day.